Lorna, why did you start this petition?
Because when you're in the military during war, they have these special provisions that they do have, and that would make them have more pay in terms of hazard pay, more paid leave, therapy and grief counseling, because it's very hard working in this environment, not having the proper grief counseling. You're afraid of taking this virus home to your family, and mandatory testing to make sure that they don't take this home to their family. So this is the least I could do. They're taking care of us. The least I can do is to petition and make sure that they're being taken care of because they are our heroes.
Every day we hear stories about what frontline health workers go through. Can you give us a little bit of insight into that? What are the effects on their mental, physical, and emotional well-being?
This pandemic is one that we've never seen before. Protocol, everything went out the window with COVID. And so there are nurses were at risk. They were reusing masks. They didn't have the proper shield for to cover their faces. They're afraid to go home because they're afraid to take the virus home to their families. Most of us work in women's health. We very seldom see people die. But here we are, they have to transfer some of these same people that are working in women's health over into the other units. It's very traumatic. It's been very, very traumatic. I think COVID is going to be here for a while. And the way we do things, the way we look at things, everything is going to be different because right now, I think we're getting ready for another surge. And of course, it's more politicized here in the United States than most other countries. It is a political issue. It's a red state and a blue state. So because of that, there is no cohesive way of managing this virus. And that's the only way we're going to combat it or beat it is by making sure that we have leadership that's going to do a comprehensive care in terms of management. Right now, you have different states have different rules. And so it's very, very challenging. We don't have enough testing. That I don't think we'll ever have enough anytime soon. But I know it's better in terms of where we're getting the supplies that they need. It's much better than when we just started.
I'm sure by now health workers around the world feel like they're part of some sort of global family, given that their experiences are universal. What is your message to frontline workers in countries across Africa?
I would say keep going, keep at it, keep doing what you're taught to do because it's hard for all of us anyway. They really don't need my voice or my message. And I can speak a little bit on Malawi, which is one of the poorest countries on the continent, and there they have about a total of about 7,000 cases and less than 200 deaths. They're used to pandemics. They're used to having these crises, whether it's Ebola or malaria, and they're not used to having all the supplies and equipment and all the necessary things that they need. They've always been used to compromise or try to be creative. For example, if I talk about one of the agencies or one of the organizations that I'm affiliated with, it's called IDA, I Demand Access. And what they're doing in their little village, they're going door to door basically, or knocking on doors and giving people food and masks and educating them on it because otherwise they don't have TV and radio to hear what's going on. They're taking it very seriously in their little village, and they have horns that they drive around and loudspeaker speak to the folks. And we have so much here, and we're not able to contain it. So that's the difference, I think.